Birth control methods, the IUD. IUD stands for intrauterine device. IUDs are a type of long-acting reversible contraceptive, or LARCs. LARCs are the most effective birth control method. In the US, there are 5 types of IUDs: Mirena, Paragard, Skyla, Liletta, and Kylena. An IUD is a little T-shaped piece of plastic that is put in your uterus that interferes with the way sperm moves and prevents fertilization of the egg. A healthcare provider places it inside a woman's uterus to prevent pregnancy. It stays there and works for up to 3, 5, or even 12 years, depending on which type of IUD is used. A healthcare provider can remove the IUD at any time the woman wishes to get pregnant or change her birth control method. How does it work? All the different types of IUDs change the environment in the uterus. By implanting the IUD, it causes the uterus to produce chemicals that make sperm unable to move. Therefore, by changing the environment of the uterus, the sperm never meets the egg. The first type of IUD is the Paragard IUD, also called the copper T. This IUD is partly wrapped in a fine copper wire. The copper limits sperm production and prevents the sperm from fertilizing the egg. There are also different types of hormonal IUDs, but the way they all work is that hormonal IUDs release small amounts of the hormone progestin into the uterus. This hormone thins the lining of the uterus, which prevents the egg from implanting and therefore preventing pregnancy. Progestin also slows sperm movement and reduces sperm survival. And it also makes the mucus of the cervix thick and sticky, which keeps the sperm from getting into the uterus. If sperm can't get into the uterus, they cannot meet with an egg. How effective are IUDs? As opposed to other birth control methods that depend on the patient, because IUDs are implanted by a professional medical provider, they are one of the most effective birth control methods. The Paragard IUD, or copper T, is 99.2% effective, and hormonal IUDs are 99.8% effective. It is important to note that IUDs do not help prevent against HIV or other STIs, so use a condom every time you have sex to help prevent these infections. How do you use an IUD? In order to use an IUD, you first need to talk to a healthcare provider about whether the IUD is right for you. You will be checked to make sure your uterus and cervix are suitable for the IUD. A healthcare provider must place the IUD. It can be placed at any time that you are not pregnant. The healthcare provider uses a special applicator to place the IUD through the cervix and into the uterus. After you have placed the IUD, it is suggested that you feel for the IUD strings in your vagina about once a month. This is a way to check that it is still in place. If you notice any irregularities with the strings, you must contact your healthcare provider right away. What are some advantages of IUDs? It doesn't interrupt sex. They last for a very long time. It works very well to help prevent pregnancy. And you may even have lighter periods or no periods at all with hormonal IUDs. Thank you for watching, and if you have any questions or are interested in getting an IUD, give us a call at 310-450-2191.